Hello, my name is Philip Langridge and I'm the Specialist Physiotherapist at the National Aspergillosis Centre at Wythenshawe Hospital in Manchester in the United Kingdom. When patients come into our clinic, one of the things we ask of them is to produce sputum samples, and we analyse those, and the results tell us useful information that helps make decisions about their care. Now, sometimes it's very difficult to produce sputum at the drop of a hat into a pot, and a lot of what I do in clinic is to help patients do that task. Now, there are a couple of simple things that you can do to help mucus move out of your chest, and I thought it would be helpful to give you some quick and easy tips to help that happen, so that either you can produce some sputum into a pot and bring it to the clinic from home, or you can use those techniques while you're waiting to see the doctors in clinic, and then hand over your sputum samples if you manage to produce one. There's a simple sequence of exercises. There are 4 stages, and you repeat these stages in a cycle. Now, this cycle is slightly different to what's known as the active cycle of breathing techniques. This is a slightly abridged version of that, so it's modified. But most people will find it effective just to produce a bit of sputum for us to analyse. So, what are these exercises? Well, the first stage is to loosen up what's on your chest. And to do that, all you need to do is get lots of air into your lungs, and that helps to loosen things up and get it ready to move. Okay, so all you need to do is take a massive breath in, and just let it out passively. Ideally, you hold it in for a couple of seconds. It tends to work better if you can manage that. But the real trick is to get as much air in as you can. So you start off by taking between 3 and 5 really good massive breaths in. Between 3 and 5 deep breaths should suffice. If you take more than that, you're likely to do something called hyperventilate or overbreathe, and that can make you feel a bit dizzy or give you a bit of a headache. So don't do too many deep breaths in a row. The second stage is to push mucus from the tiniest tubes that are furthest away in your lungs, more to the middle, to the medium-sized tubes. And to do that, you do something called long, slow, gentle huffs. Now, huffing is a technique that is like when you steam up a mirror or a window, or say I was to try and clean my glasses. I wouldn't blow on them. What I do is something called huffing. So I go, it's a forced breath out with relaxed cheeks. And there are different sorts of huff, but the huff you need to do first is designed to push mucus from effectively the edges to the middle. And to do that, you take an average breath in and you do a long, slow, gentle huff out, like this. Now, the breathier you make your gentle huff sound, the better it is. And what you should expect to find is it starts off quite easy, but you have to then start using your chest and your stomach muscles to help push the air out. Okay? Don't go all the way to the end, but you have to push till almost lung emptiness, really. So I'll do a few more of those because, again, you need to do between 3 and 5 of these. Okay? So, normal breath in. Now, don't worry if you hear a rustly noise or a wheezy noise. It tends to just be because sputum is moving closer to the top of your chest. Okay, so we've done deep breaths to start with, filling your lungs as much as you can. Next we did some long, slow, gentle huffs. Now it's time to try and bring it closer to the top of your chest. And we're going to try and push that mucus up to this point. Okay, and once it gets to here, then you can cough and hopefully clear it. So to move it from the middle up to here, you take a massive breath in and almost straight away you do a big, strong, short, fast huff out. Like doing a peak flow meter reading if you've ever used one of those. So big breath in, short, sharp, fast out, huff out. Like this. Okay. If that hasn't shifted anything, do it again. Maximum of 3 times, really. And then if you haven't coughed already, do a big strong cough to clear the top. That sequence of deep breaths, slow, long, gentle huffs, short, fast, strong huffs, and cough, you can repeat several times through until you produce some sputum. If you haven't produced any sputum after 5 to 10 minutes, don't worry. No sense keeping going for half an hour. Just ask a physiotherapist in clinic and we'll try and help you with some other techniques. But hopefully those 4 stages, deep breaths, slow huffs, fast huffs, cough, done a few times, will help reproduce the sputum sample that will help us treat you. Thank you very much for your attention.